Good morning, everyone. Myself, Dr. Mohini Agrawal. I am working as senior resident in AFMC Pune. Uh, uh, my topic for today is tuberculosis and neuromyelitis optica spectrum disorder, a conundrum. As we all know, tuberculosis is a major health problem, and the theme of on TB Day 2022 it was invest to end TB and save lives. And the story is no different for ophthalmologists. We need to invest to end TB and save vision. So here I'll be reporting two pediatric cases with neuromyelitis optica spectrum disorder that did not fulfill the diagnostic criteria for NMO. They were negative for aquaporin 4 antibodies, and the associated undiagnosed tuberculosis at the time of the presentation of those two cases clouded the diagnosis and delayed the treatment. So the first case, he was 15 years of male. He presented with rapidly progressive, profound vision loss in the left eye, followed by right eye 6 months ago. The vision was perception of light with accurate projection of rays in both the eyes. And on fundus examination, we could see bilateral disc edema with arteriolar attenuation and venous dilatation with normal FR. On digging more into history, we could found that he had an episode of fever and cough followed by transient weakness in both lower limbs and urinary retention 10 days prior to involvement of the left eye. The MRI spine was done at that time and it was suggestive of LETM, which is longitudinally extensive transverse myelitis. So this LETM is one of the specific feature for NMO, and it is rarely seen. It's a rarest presentation in the tuberculosis. So here we diagnose the patient as NMO, but because aquaporin 4 antibodies were negative, so we diagnosed him as under spectrum disorder. But to our surprise, the Cox lesion with cavitations was seen on the chest X-ray, which was suggestive of tuberculosis, and thus the patient was suspicious of tubercular optic neuritis as well. So other investigations rest were normal. The acute phase reactants like ESR and CSF had pleocytosis also. So we treated the patient as tubercular optic neuritis and started the patient on anti-tubercular treatment. But the vision loss continued. It did not improve. So while going through literature, we could find out that there is some association between NMOSD and this thing. So we did not initially we withheld with these steroids, but in view of continued vision loss and profound severe vision loss at the presentation, we started the patient on these steroids, and the patient improved in the right eye, but by that time he had already developed optic atrophy in the left eye. The similar case came after a few months. It was 8 years old male presented with same diminution of vision, profound vision loss to perception of light, and presented with the same fundus picture, bilateral disc edema. He had also an episode of fever and cough followed by the transient weakness in both lower limbs and urinary retention 4 months prior to ocular involvement. So old MRI was suggestive of LETM, so same. Here we diagnosed the patient as NMO. We could find out that the aquaporin 4 antibodies were negative, and it was labeled as NMOSD case. MRI orbit were also showing involvement of the optic nerves. But here comes the MRI brain, which was suggestive of cerebral tuberculomas, and it literally clouded our diagnosis. The MON2 test was also positive. Here the chest X-ray was negative, and the ESR were raised, and the blood test they were suggestive of this in the tubercular atypical optic neuritis was labeled. But as we were already aware of this similar case, so this patient was, this time it was treated as a NMOSD with tubercular association without any delay. And so ATT along with the steroids were given, and to our this thing that we could see the drastic improvement over 3 days, that it improved to 2/60, and over 6 months the vision improved to 6/12 in the right eye and 6/9 in the left eye. So it was only temporal pallor was there. We have saved the eye. So as we all are aware that there is criteria for tubercular optic neuropathy. We have consistent ocular signs and MON2 positive and response to 4 drugs of anti-tubercular treatment. And this LETM, it is one of the transverse, there's a difference between transverse myelitis and longitudinal extensive, that in transverse myelitis, it is only involvement of the 2 or less than 2 spinal segments, whereas in transverse, it is 3 or more than 3. Now the transverse myelitis itself is very rare in tuberculosis, and so LETM makes it more rare presentation in these cases. So this all clouded our diagnosis. And we have laid out criteria for neuromyelitis optica spectrum disorder, which the patient presented to us, and children are likely to be seronegative for aquaporin 4 antibodies. So the problem here was that if we start the patient on ATT alone, it causes paradoxical worsening of the vision due to the death of the tuberculosis antigen and causing increased inflammation. And if we start the steroids alone, it could have flared up the TB. So the combination has shown similar response as monotherapy also, but the studies have shown that it prevents paradoxical responses, prevents recurrences, and especially in the cases where you have severe profound loss, like the patient reaching vision to perception of light, we should not withhold these methylprednisolone steroids. So the questions arises here is there any association between the...
Can you just finish it up early because we are just getting late for the another session?
Yes, sir.
The time is not up. Is it up or it's
Yeah, it is up.
Yes.
Yeah.
So there is concurrent use of...
Please conclude.
So the question arises that concurrent use of ATT and steroid should be done, or is there any association between tuberculosis and anemia?
So
Thank you, sir.
What made you think that this is neuromyelitis optica and not a tubercular optic neuritis from the very beginning? You didn't have any demyelinating lesions on the MRI, did you have?
Yes, sir.
Yeah, in the first that MRI,
Yes, sir.
she was showing that longitudinal segments
Yes,
they
sir,
were
sir.
involved.
Okay.
All were
okay.
in both the
Those were
cases,
suggestive of
Yes.
demyelination.
demyelination.
Okay.